And we're live. Hi, good evening, everybody. Welcome to She Built It Boss Lady Chronicles. I am Sharita Gaskins-Stillette. I am your host. And this is the show where we feature the amazing inspirational stories of women who are owning their power to transform their lives. And so tonight's guest is extraordinarily special to me. So I can't wait to introduce you to her. But I'm going to allow a couple minutes for other people to jump on. If you're watching us live, please say hi in the comments. If you're watching the replay, hashtag replay, still say hi in the comments. I also encourage you to put your questions in the comments, especially if you're watching the replay. I'm happy to pass your questions along. And then I also want to remind you that registration is still open for A Weekend for Me, the premier wellness experience for professional women taking place October 2nd through the 5th in Grand Cayman. And this one is extra special because we are going to be exploring radical rest. Right now, we are living through so much toxicity and turmoil and negativity that really we need to rest and reset. I actually, if you follow me, I did a solo retreat experience for myself in Panama last week. And it was so restorative just to be away and just to have that time to reflect. I came back full of energy. And so if you need time like that, I encourage you to register for A Weekend for Me. There's still space. I would love to have you. So without further ado, I have the honor of introducing tonight's guest. Dr. Gjanje Smith-Mathus is a Liberian-born and US trained board certified urologist, urogynecologist at WakeMed Physician Practices in Raleigh, North Carolina, where she also serves as a member of the Diversity and Inclusion Council's Advocacy and Policy Committee, and as Clerkship Director for the Urology Medical Student Rotation. She obtained her medical degree from Georgetown University School of Medicine and completed her urology residency at the Lahey Clinic in Burlington, Massachusetts. Dr. Smith-Mathus completed a fellowship in urogynecology and reconstructive pelvic surgery at Virginia Mason Medical Center in Seattle, Washington. She obtained a master's in public health with certificates in global health and health finance and management from the Johns Hopkins Bloomberg School of Public Health. She practiced in Seattle for 10 years before moving with her family to North Carolina in 2022. Dr. Smith-Mathus is passionate about giving back to her native Liberia. She is the founder and president of Susu Health Foundation, a nonprofit dedicated to advancing healthcare for all her native Liberia by empowering, cultivating, and supporting local healthcare workers and communities through sustainable collaboration and shared learning with the diaspora. Since its establishment in 2019, Susu Health Foundation has supported several programs in Liberia, covering critical needs such as reproductive health, cancer screening and treatment, shipping of medical supplies, and health literacy. Outside of work, she enjoys spending time with her family, reading, traveling, cooking, crocheting, and listening to music. Welcome, Dr. Gjanje. How are you?
I am doing okay. Thank you. Thank you. Thank
Good.
you
So,
for
so,
having
so
me.
what I did not tell you guys in that long introduction is that Gjanje is one of my med school besties. So this is really special to me because I get to talk to her here, and I know firsthand what a rock star she is. So I am super excited to have you with us tonight, and I can't wait to share your story with everybody.
Thank you so much. I've been looking forward to this conversation like since we booked it. So thank you.
Awesome, awesome, awesome. So I usually start by having you kind of take us through your journey. I mean, and I know some of your background, so I know you have an interesting journey. Tell me about your childhood, your upbringing, and kind of how you ended up in medicine.
Okay. So you said, I'm originally from Liberia, born and raised. I lived there till I was 15 years old. My family stayed for about a year during the Civil War, and then we fled to Ghana in late 1990. I stayed in Ghana for 2 years as a refugee, attended boarding school. So, we were very blessed in that, my parents, with support of family in the States, were able to get us into boarding school. And then after 2 years, moved to Maryland. Interestingly, I really, really wanted to be in Madison, Wisconsin.
Okay, wait a minute. Hold on. Why Madison, Wisconsin? This is the first time I'm hearing this. Why Madison,
Well,
Wisconsin?
because my cousins, who were like my sisters growing up, so, one cousin is like a couple of weeks older and the other one is a year younger. We were very close. We always went to the same schools and always had, all these like extended sleepovers. And they were in Madison. And
Okay.
I wanted to hang out with them. I didn't know Madison, so it seemed like a good idea. And my parents were like, no, you're coming with us. So, so that didn't work out. So I ended up in Maryland, started out at Montgomery College in Rockville. And Montgomery College was really set up for a seamless transition to University of Maryland, where pretty much everyone I know who transferred from MC to Maryland had all of the credits transfer. I met lots of students from New York and other places who had all these problems with some of their credits not transferring and having to repeat classes and whatnot, but that was not the case. So starting college, I was an engineering major because I was a math and physics geek in high school. I really liked math. I really liked physics. Don't judge. Miss Gibson, who was my physics teacher in high school in Liberia at St. Teresa's Convent, the all-girls school I went to, she was stern and strict, but really good. And somehow because of her, I really liked physics. So physics and math made sense to be an engineering major in college. It's like, practical, these things align, let's do it. And also, my family, there were lots of examples of lawyers and engineers. And for lots of reasons, which would make my dad very disappointed, I was not interested in going to law school. My father's a lawyer. So I'm like, well, I like math and physics. Engineering makes sense. Let's do that. I thought about medicine on and off in elementary school and younger, but I had this, blame it on too much TV. I had this vision of doctors having a pager on their side and you're at dinner with your family and the pager goes off and you got to drop everything and run to the hospital. And I was like, that's no life. That's no family. And, one thing I came to appreciate, going through the war and being in Ghana and all that was the value of the family relationships. And I didn't want to have any career that would sacrifice that. So I kind of just blew off medicine. I'm like, that's not going to happen. That's not for me. So I started college as an engineering major and got the first C of my entire life. It was very devastating. You know me.
Yes, I know. I do know you.
Huh? So, sorry. And how did that happen? Well, I was bored.
Okay.
I didn't like engineering, it turns out. So I just stopped going to class. I was still at Montgomery College. I would look at the clock, go, oh yeah, class is starting right now. And I would hang out in the cafeteria, eat French fries and play spades.
Oh, wow.
Totally not
Okay.
for
So
class.
I don't know that person. But anyway, go ahead.
So, and my physics teacher at MC, Dr. Day, he called me to his office and he's like, what's going on? Because I went from being a kid who sat in the front row answering all the questions to just not showing up. And he's like, I don't know what's going on with you, but you have to figure it out. I know you're, good student, blah, blah, blah. I'm not, whatever it is, you need to fix it.
Yes.
And I said, okay. So I skated on by, got a couple of C's that year. And I was like, ooh, this hurts. Like, ooh, this is not me.
Right.
Well, I transferred to University of Maryland. I was accepted into the School of Engineering. And at that point, I kind of knew I didn't want to do it, but I was kind of lost and didn't know what to do.
And that's kind of, I think it's unfair that we're expected to make these major life decisions at such young ages because we don't even know ourselves yet, right? And they're wanting us to like commit thousands and thousands of dollars and years of our lives to
figure out their life at like 18, 19, 20. Yeah. So I get to Maryland and I was like, okay, I'm going to do one engineering class. And I think I did like biostats for engineering students. Then I did psychology. I did sociology. I did psychology, sociology, biology 101 or 105, whatever that was. And then like Shakespearean literature, clearly trying to find myself.
Right, right.
And one of my biology lab partner invited me at some point during the semester. She invited me to a pre-med society meeting. So mind you, by the time I'm at Maryland, I had enough. I was 3 credits shy of being a junior when I transferred after 2 years at MC.
Right.
So she invites me to this pre-med society meeting, and I'm like, I'm not interested. And she's like, well, there's free food. And I was like, okay, now I'm in.
Right. Speaking the college students' language.
Because I was like running out of money on my meal plan because it was like towards end of the semester. I was like, yeah, I'll go, free food, whatever. I'm not interested, but feed me and I'm good. And that meeting changed my life. I wish I knew who this person was. This was a young Black woman who was a family medicine physician from somewhere in the area, who was a mother. I remember her son was 11 or 12 years old. And she talked to the group about navigating medicine with a child and with a family and how she made that work. And I was like, oh my gosh, it is possible. Yeah. And after that, I switched. At first, I wanted to do like double major, biology and psychology. Then there was all this, if you do psychology, you got to get a PhD. And it was just
right.
a lot.
Right.
So I ended up switching to neurobiology and getting kind of pre-med track. But yeah, so that was the thing because it took seeing somebody who looked like me doing the thing that I thought was impossible to make me go, oh, I could do.
And I think that's one of the reasons it's so important for us to be visible,
Mm-hmm.
because it is inspirational to other people. And that's one of the reasons that I do this show, because, we'll learn later some of the things that you've done, in medicine and, kind of tangential to medicine. But, it's to inspire other people. If she can do it, I can do it too.
Yes.
So that if you can see the example, then you can aspire to something that maybe you hadn't opened your mind to before, or maybe something you'd even closed it to.
Exactly. And in my case, I had considered it and closed my mind to it because I thought it was impossible. So like seeing her and hearing her story at that meeting was life-changing. That's why I feel so strongly about mentorship, because like you said, it takes like seeing yourself in that person to even think it's achievable. Yeah.
Okay. So then you got to med school, and what happened there? Because you got a story.
Well, let's see. So, well, Nick happened first.
Yes, I think that's the part of the story I was talking about.
So Nick happened first. So my senior year of college, I was blessed with my first child, Nicholas, who I had a few months after graduation. So I graduated in May. I had Nicholas in August. Thankfully, I had already taken the MCAT, so I got that out of the way. And I remember the dread of telling my parents I was pregnant, because I am the good girl, and good girls don't get pregnant in college before they have all their ducks in a row. And I have to ask my dad if he said this to me just to push me, because he knows how to push my buttons. But when he finally got over the I can't believe this is happening and calmed down to have a conversation with me, one of the first things he told me was, I guess this means you're not going to medical school anymore. And I was like, oh, I will show you, old man. So when I was because I had already taken my MCAT, thank goodness. So so when I was on maternity leave with Nick is when I applied to med school. And you remember back then it was like the typewriter, and the cardstock paper, and you had to type your entire application, and the correction tape and all that.
Back in the Stone Ages, right?
Exactly. If you have the electronic application, imagine typing that entire thing on a typewriter. So I did my applications while he napped. And I was like, because I got to prove to this man that, my life is not over because I have a baby. So I applied And this was just like stepping out on faith. And thankfully, I'm not applying in 2025 when it's way, way harder to get in. This was, 1998. So I only applied to schools in the Maryland, DC area because I had a lot of family support.
Right.
Both my family and my husband at the time, his entire family's in DC. So it made sense if I'm trying to do medical school with this kid, only apply to these areas. So I applied and got in and almost was not your classmate because I got in to the class that started the year before us in 1999.
Mm-hmm.
And at that point, I pretty much knew I wanted to go to Georgetown. And then I freaked out. I panicked like I had never panicked. I don't know that I had panicked about something this big before, but I was just like, I am not ready. I cannot. Something in my brain told me I could not start medical school with a 1-year-old, but I could do it with a 2-year-old.
Right. What's the difference? Almost, right?
I don't know. So I contacted Georgetown and I was like, look, I want to come here, but due to family, I finessed it somehow. It wasn't like I'm the crazy chick who thinks I can do this with a 2-year-old, not a 1-year-old. Due to family things, I can't start this year, but I am committed to coming here. I want to be there. And, basically, can I defer admission for a year? And they said, absolutely, yes. As long as you decline any acceptances to any other schools, we will hold a seat for you in the class of 2004. And you can start in the fall of 2000. And I was like, okay. And that's how we ended up classmates.
And how we ended up having Nick as our med school baby.
Exactly.
He belonged to the whole class.
Exactly. Our classmate, yes.
And I can't believe our med school baby is now graduated from law school.
Yes. So, living in New York. He's moved to New York since the last time we talked.
Wow.
Yes. Yeah. Yes.
Okay. So, so we, got to med school, and I have to tell you guys, that baby did not stop Gjanje one bit. She was like the top of our class. I mean, when I tell you she's a rock star, I tell you no lies. There are no lies here. Come on now. You're being modest. There are no lies here. She was a great mom and a great student all at the same time. And she brings that spirit of excellence to everything that she does.
Thank you. And I have to say I'm glad I was blessed and fortunate to get into school in DC, because I think the family support
is
a huge difference. And Nick was such an easy baby and just an easy kid. So I think the personality of the kid and the support really, really made a difference. So thank you, Nicholas.
All right. So now let's fast forward a bit, because you got through med school. You're now a practicing urologist and have gotten a master's in public health. And so I guess I'm wondering what kind of moved you in the direction of public health, and what were your plans for using that degree?
Interestingly, when I decided to pursue my MPH, I was not in a good place with clinical medicine. I was extremely burnt out. That's why I love, hearing about your trip to Panama and the self-care that you're doing and encouraging people to do. I was burnt out. I think if you looked up, I did a self-assessment on burnout and I scored in the extreme red.
Yes.
So I described it to somebody at the time, like I felt like I was drowning.
Mm-hmm.
Like I literally felt like I was treading water and drowning and going under and was not going to make it. So initially, the MPH was supposed to be my exit strategy from clinical medicine. Clearly that didn't work.
Right.
I'm back in clinical medicine, but that was how that started. And then during the program, we had the ability to get these certificates where some of the electives that we had to do anyway could go towards certificates in addition to getting the MPH. And I was really interested in global health because I've always wanted to do things back home. So I think the most useful piece of my MPH was the certificate in global health, because all of those electives, we were looking at, social determinants of health and how they impact health outcomes and access to healthcare and delivery, and all of the things that are more kind of front of mind now in medicine, but back in, when did I start, 2017,
Right.
was not necessarily top of mind. So it really, really helps. And then my capstone during the MPH was all around building programs to support healthcare in Liberia. So it kind of helped me for something I had always wanted to do, but had kind of brushed aside as, oh, the timing is not right. Um,
Right.
my capstone was almost the beginnings of a blueprint
Okay.
for my next step. So it ends up not being the exit strategy that I thought it would be, but it definitely paved the way for like a parallel path
Right.
to my clinical practice.
Well, I think it's interesting how that happens. And I say this on the show not infrequently when I'm listening to the stories. It's like, there's like breadcrumbs that you follow in your life. And each thing you do really does lead you to the next thing. And
Exactly.
it can be something that you totally didn't expect and didn't plan for, but everything was preparing you for that next step.
Mhm,
And so you kind of brushed past the childhood in Liberia and the fact that there was a civil war, but I
mhm.
kind of want to revisit that. I don't know if you remember, but what was Liberia like before the Civil War? What was the infrastructure like? And then if you could juxtapose that to what Liberia is like today.
Honestly, I think my experience may be a little different. It really depends on who you talk to. I was very sheltered.
Okay.
Um, I was very sheltered, went to, my parents were not like wealthy on the scale of poverty and extreme wealth, but we were comfortable. So, I grew up very sheltered. I would go, I had a I had a relaxer and I'd go like this to my dad and hold my hand out and get money to get my hair done. Right. Like like the roots are coming in,
All right.
I'd hold my hand out and and get what I wanted. I was not really privy to issues around healthcare. I know,
Sure.
and when I needed surgery, I got the surgery. When I needed my teeth pulled, the dentist pulled my teeth. Like, but again, my parents were in a position to provide those things. As I have gotten older, I've realized that the wealth disparity and wealth gap in the country that we see now existed even back then. I was just not, I was not aware.
Yeah, sure.
I was not aware of it as a child. Now it's, it's much more glaring. I think I saw a statistic and I was hoping I would remember this. My brain doesn't remember numbers. But a large percentage of the population lives below the poverty line. So access to healthcare is an issue. Some people, even in the capital city, don't even have access to basic, things like electricity, like reliable electricity and running water. And some of that has to do with the infrastructure being devastated, from the Civil War, because
Right.
after years and years and years of civil war, some of those things were destroyed and have not been rebuilt. Um, but does that answer your question? Kind of, sort
Yeah,
of?
it kind of sort of. I guess what I'm so you started the foundation. Tell us about the foundation
Okay.
and what the purpose of the foundation is, what you're trying to accomplish, and I guess what the need, why the need. I think that's what I was getting at.
Okay.
What was it like before, and why is the need so great now?
Yeah. So when I was back home, so when I left in 1990, the first time I went back was in 2009. So I traveled to Nigeria for a mission trip with an organization, International Volunteers in Urology, IVU. So they support teams of urologists, and it's like urologists and residents and fellows who travel to these different places and do these, medical surgical workshops and basically trying to build capacity locally. So I spent a week at a fistula clinic, vescovaginal fistula in Norton, Virginia, Norton, Nigeria. And I went, well, if I'm in Nigeria, I'm practically down the street from Liberia. So I tacked on a 4-day trip back home, went home, met with a couple of people, visited the fistula clinic in the country. And initially, when I came home, I wanted to try to set up Liberia as a site for IVU med. But I really, once I was back in Massachusetts, I was a resident going into my chief year, which was super busy. I was unable to get the information that I needed, because in order to set it up as a site, you needed to demonstrate a need, and I needed all this data, and I was no longer getting the responses that would get me the data.
Sure.
Then I tried contacting, somebody else who had an organization that was already doing work, and that didn't happen. Fast forward 10 years later, which was the next time I went back home, 2019, for my aunt's funeral. And this time I had contacted a couple of people in advance of that trip to just meet up and kind of get a sense of the lay of the land.
Right.
One of the people I met was Dr. Nicole Cooper. So she's med peds, US trained, but moved back home. And at the time was medical director at Jamali, which is a private clinic. So I met with her. We had a really good meeting, really good talk. I went with her to JFK Hospital, which is the teaching hospital in Monrovia. I attended grand rounds with her, and I left like really invigorated. And I'm like, oh, I could do something around medical education. Like, it would be great to collaborate with, US trained Liberians who are in the diaspora with folks back home and do education. So initially that was the plan, was building something to support medical education back home, with, supplies and visiting professorships and grand rounds and skills workshops and whatnot. So the funeral was May 2019. I came back, I grabbed my notebook. I still have that notebook, this notebook, and I started scribbling like thoughts and ideas for what I want to do. I started out, with, okay, we're focusing on education. What's the need? And I, looked up, if you look up WHO statistics on, the thresholds for skilled healthcare professionals, to meet the SDG goals for 2030 is like what, 44 per
10,000
population. At the time, I think for Liberia it was less than 5. Our life expectancy, was like 60 something, early 60s. So all of the, the metrics and healthcare outcomes and all of that was low. And then looking into it, it was like, well, there is the folks who are like, Dr. Cooper, and, we have doctors who train there and stayed, are doing the work and are really trying, but there's not enough of them, and there's not enough resources.
Right.
Because we had, people who moved even before the Civil War, because there was some other unrest and things that happened before that. Then we have a Civil War that goes from like 1989 to like early 2000s. And then, the medical school, because of lack of resources and because of like lack of financial support for students, there's a high attrition rate from the medical school, where I think on average, we're graduating maybe 25 a year, but that's with 75 starting, right? So the attrition rate is high. So, I really wanted to do something to support that. And I also know lots of people my age who are in the same boat, who have trained here. I know folks like who are, neurosurgeon, plastic surgeon, CT surgeon, nurses, occupational therapy, physical therapy, like you name it. There's so many Liberians just in the US alone. I'm not even talking other countries, who work in healthcare, who care and want to do something, but doing that something feels like such a daunting task that you don't know where to start.
Right.
So the idea was to create a platform that would allow people to do just that.
Okay.
And that's why the tagline, if not you, then who? Because we can complain all we want, but if you don't do something about it, who do you expect to do something about it?
Yes.
And if not now, then when? And for me, that was important because I started thinking about this in 2009, and here we are, 2019, and I'm
Right.
like, oh, but it's a lot. You know, I'm working now. I got the kids, so it was like, just shut up and do it.
Yeah. So
And what
that tagline was for you. It was
it
as
was
much for you as it is for anybody else.
good for me. And then the name, I wanted something that would be easy to say no matter what language. Because, you know, people see my name, Gjanje, and if they don't know it's Gjanje, they're like, do you say the G, the J? What do you say? So I didn't want something that would be so complicated that people struggle with how to say it, but I wanted it to mean something. And growing up in Liberia, I participated in Susu quite a bit. And that would be where, and we were like little, so you'd have like each person put in $5 each month. And at the end of the month, Sharita gets to take home the $30 because there's 6 of us. And then next month, you take it home. So everybody chips in and one person takes home the pot at the end of the month.
Okay.
And when you've rotated and everyone has cashed in, you can stop or you can keep going.
Okay.
So I'm like, okay, so this would be built on that general concept of everyone chipping in. But now just the twist is instead of one person taking home the pot at the end of the month, everyone benefits. But
Okay.
that's where the name came from.
So collective economics.
Exactly.
Okay. And so when was Susu founded and what has been the impact so far?
So I registered the organization in 2019 in Washington State. And we started, of course, then COVID hit in 2020. So registered in 2019, but October. So by the time I had gotten the board together and everything, it was early 2020. I'm in Seattle where the first COVID case and death is like minutes from my house. So we shut down pretty early. So 2020, we were kind of limited, and we were also in the process of applying for our tax exempt status. So at the time, my mom and sister were in Liberia, and I'm keeping an eye on people dealing with COVID back there. And she told me about these neighborhoods where driving into the neighborhoods, the young men who lived in the neighborhood would have like almost a checkpoint, a rope across the road leading into their community. And they would have soap and water and hand sanitizers. And they're like, you got to wash your hands before you come in. So they were doing their part to try to help contain things. So she helped me. And our thing for that year was we supplied five of these checkpoints with rice and Maggie cubes and oil and face mask and soap and hand sanitizer. So we had these packages that she delivered to 5 of them, just like, we see you, we appreciate you, thank you for what you're doing. So we started with that. Then, kept holding on like, okay, this COVID thing is going to end and we can do more soon. 2021, we're still dealing with COVID. So 2021, we did a lot of virtual things like some COVID awareness videos, awareness around the COVID vaccine. That year, we also did at least some shipment of medical supplies. The first shipment in March of 2021 was like for suture and materials to JFK Hospital, based on a direct request from them. In July, August of that year, we did a combined fundraiser with Zeta Phi Beta Sorority Incorporated, because they have a chapter in Liberia, and LIB Healthline, which is another organization, because we became aware through our contact at LIB Healthline, thank you, Frida, that because of limited resources and funding, PPE, personal protective equipment like gloves and whatnot, were from the government, was primarily going to public facilities, and the private clinics were underfunded. So we did a fundraising to get PPE to the clinics. And then later that year, there's another organization, Women with Initiatives, that was shipping. They had a supply of walkers and wheelchairs and stuff that was going to a rehab facility there. And they needed help with the shipment. So we helped with that. We started in 2021 also. We did a virtual series on mental health. So Dr. Sam William, who is another Liberian-born but US trained physician, he's a psychiatrist in the DMV area. He did a 2-part webinar series for healthcare workers. This was in collaboration with the Healthcare Federation of Liberia. So he did one on the psychological impact of being a healthcare worker in the pandemic. And then the second one on depression in primary care, how to recognize the symptoms, diagnosis and treatments. And the beauty of it, he did this after collaborating with a local psychiatrist who could give him kind of relevant, culturally relevant information to make this useful for the attendees. Since 2021, and this has been one of our biggest things, has been our breast cancer screening program. So remember Dr. Cooper, who I met in 2019 back home? Well, 2021, now we're dealing with the daggone Delta wave. So I reached out to her and I was like, look, Breast Cancer Awareness Month is coming up. We would love to do something with you around that, like funding mammograms, for women who need breast cancer screening. So we started working with her that year. And in the first year, we funded mammograms and breast ultrasounds for 16 women.
Okay.
And we funded the treatment of a young woman. She was a widowed mother of 5 with advanced breast cancer. She ended up dying of her disease, but we were able to help support her treatment during that time. The following year, it grew because the young woman from LIB Healthline and the Zeta Phi Beta reached out to me about collaborating on breast cancer. And I went, well, I'm already working with Dr. Cooper. Why don't we're all doing parallel.
Pool resources.
Why don't we pool resources and work together? And that led to an incredible, phenomenal thing. So we ended up bringing to the table Susu Health Foundation, Wellness Partners, which is Dr. Cooper, Hope for Women, which is another private clinic in Monrovia, and members of the 4 Black sororities who are active in Liberia.
Oh, wow.
So yes. So AKA the Deltas, the Zetas, SG Row.
Okay.
And we have been doing this since 2021. So I have the numbers on because I cannot remember numbers. But 2021, we screened 109 women.
Okay.
So the screening
That's a big jump from 16.
Exactly. So the screening, mind you, includes the clinical breast exam. And then there's screens, we have outreach nurses from Wellness Partners and Hope for Women do the intake, and then they're referred for imaging. So of the 109 that were screened, 24 completed mammograms and 1 was diagnosed with breast cancer. In 2023, that number went up to 339 women. And last year, the number of women screened was over 462.
Excellent.
So it has grown, from Wellness Partners and Hope for Women provide outreach nurses who go out into communities, marketplaces. We even branched outside of Monrovia last year with some of the screening. Unfortunately, because of poor access to imaging and just, some of it is lack of awareness and education around breast cancer, we are finding women with more advanced breast cancer because, routine mammograms are not being done, right? You and I, we're blessed. We can get our mammograms every year. Does it feel like your breasts are being squished in a waffle iron? Yes. Is it uncomfortable? Yes. But we do it because we're able to have access to it.
And it's quick. It's not, it's not that, to me, it's not that big a deal. It's a small price to pay. Right?
It's a small price to pay, but an uncomfortable one. But I digress. But, and mammograms, the regular price for mammograms is like $55, which, for some people, that's a lot of money. So since 2021, during the month of October, we, in collaboration with the partners I named before, have the outreach, the screening, and then for people who meet the criteria, we refer for imaging. And we have it worked out where we get a discounted rate on the mammogram. So, like this year, the regular price on mammograms is $55. Our discounted price in the month of October is $35. So we get a bit of a break on the mammograms. And, so we're in the process we're actually planning is underway for the October 2025 breast cancer campaign. We rotate the project lead every year. This year it's Susu Health Foundation, so we're the leads this year. But we have the blueprints and all the rules and tips and tricks from the organizations that did it the last few years, and we're just building on that each year. Besides breast cancer screening, the other thing that's been near and dear to my heart is the menstrual health symposium. So this is with SGRO. This is their baby. They do it. So their they have members in several West African countries, and they do it in Ghana, Sierra Leone, Liberia, where they do a symposium for school-age girls, education on menstrual health, financial literacy. So there's lots of components to it. But the girls also get a hygiene kit that contains reusable pads, underwear, soap, deodorant, and whatnot. In 2023, we sponsored 25 girls to attend. And I think it was for a total of 100, 150 girls back then. This year, we were involved in the initial planning, and the program this year was outside of Monrovia, which means a lot to me because a lot of efforts are focused on the capital city when there's a lot of need all over the country. It was in Grand Bassa County, which is where my dad's family is from. So that also hit me right there for 150 girls. Exactly. And SGRO gets the pads they already have it set up with their manufacturer in Ghana because they're covering multiple countries in West Africa, but we were able to fund, the kind of shipping and delivery of the pads to Liberia. And then the final piece is Vital Health Talk, which is, and I might be forgetting something else. I apologize if I am, but Vital Health Talk is a talk radio. And I met the amazing young nurse who does this radio talk show in 2022. So during our breast cancer campaign, we were trying to raise awareness, let people know we were doing this. And we were put in contact with this nurse, Mama Walume, she was self-funding a lot of this. So she was given airtime at, one of the very popular radio stations in Monrovia, Hot FM. And her show airs every Thursday morning from 11 to 12. But, so we went on the show to discuss our breast cancer screening. And I kept in contact with her and realized that she got the airtime, but she was self-funding everything, like equipment, lighting, internet coverage, all of it. So we've been a sponsor since 2023.
Okay.
And so we every year we she sends a budget, areas of highest need. We review the budget, figure out what we can support. And it's been great because we've been able to fund things like her equipment, the editing software, her internet subscription, just to keep this going.
Right.
Covering topics like, immunizations and, mental health and substance use disorder, hypertension, diabetes. So it's just something that is so useful.
And she's able to reach people, definitely reach people outside of the capital.
Exactly. So that is one. And this year, as a urologist, I can't be doing all this and not do men's health. So this year we're working on men's health. June was Men's Health Awareness, Men's Health Month. So we sent a shipment of over 700 catheters and other like urologic supplies to our urology contact, Dr. Cassell. He is the founder of Urocare Liberia, which is a private urology clinic. And I have reached out to him to do something around prostate cancer later in the year. We are also in the process of recruiting a board member who will be based in Liberia to work as director of medical education. So we can get back to doing, more virtual and eventually in-person workshops and whatnot. But yeah, that's
so I mean, you're doing all of this tremendous work. And I guess my question is, what can we do as a community to support the work? Because, it's very important work. Here in the United States, we take a lot of things for granted.
Mm-hmm.
You talked about the menstrual health and you talked about the access to mammograms. There are people here who refuse to get mammograms just because,
Yeah.
when there are people in other countries who are dying because they can't get mammograms. So, what can we do to support you? And I'm actually going to put in the comments now the website for Susu Health Foundation. But, what can we do to support?
So my caveat with that website, people, folks, it looks a little kind of but that's me. I have no training or expertise in web design, but our budget goes towards our programming. So I have had to design that website and maintain it. So what you see is me. So please be kind. I know it's not the best website you've ever seen, but thanks to volunteers, we have 2 volunteers, Deborah Bernard, who happens to also be my cousin, and Wani Dixon, who have volunteered to update the website. So please check back in a little bit. We're in the process. It'll look like a respectable website.
But does it serve its purpose at the moment? So the purpose is to be able to accept donations and things, correct? To disseminate information and accept donations.
Yes. And as far as how you can help, of course, donations are always welcome. A lot of what we have done, especially the first couple of years, have been funded by me, by my board, by, kind of close friends and family. Because what I didn't want to do was just run out the gate, bust out begging people for money without any kind of record of what has been done and what we will be doing with your hard-earned coin.
Right. Sure.
So I wanted to establish, kind of have some credibility before
a proven track record.
Yeah. So we have that track record, and now we're at the point of begging for money. So, so what we ask, quite honestly, is follow us on social media, Facebook, LinkedIn, Instagram, because that way, when we're sharing about different initiatives, you can help amplify our message, amplify, our voice. You can select us as your favorite charity on PayPal, so that when you make purchases, I think we get $1. So goes to your favorite charity at checkout. You can make a one-time donation. If you are so inclined and able to make a recurring donation, we will accept that as well. Because one of the limiting factors in how much we're able to do has been funding.
Sure.
Especially as we, right now with our breast cancer screening, for example, we have the nurses do the outreach, do the clinical breast exams. And sometimes our funding is limited to, we're imaging women who have palpable disease. As you know, by the time you can feel something in the breast, it's advanced. My dream would be that every woman in Liberia who is 40 years old and over is able to get a mammogram. Of course, that means we need the funding, we need the resources, because, for example, last year we were not able to do mammograms because the only machine in the country was broken. So there's still some infrastructure things and hurdles that we need to, get by, but just helping to amplify the message. Donate as you're able to. I had somebody donate when I did the 26 on You fundraiser, and somebody donated $26 and apologized. And I was like, oh my gosh, thank you so much.
Right. Because people don't understand that amount will go farther in Liberia. I think they're thinking about $26 here, that is, maybe doesn't make a big difference. Yeah. But you talked about the mammogram, you being able to get that for $35.
Exactly. I'll take $5. So any donation helps. We are, once we're up, and especially once we get our education piece running. So I'm really excited about our candidate for Director of Medical Education. Once that is confirmed, we will be announcing that. We will be looking to do more educational outreach and activities. So for folks with, relevant healthcare experience, We have a volunteer form on the website. It's kind of microfund. It's hard to see right now because, like I said, I didn't know what I was doing when I set up this site. That form will be updated when the new website rolls out, because that's the other way, is just volunteer your expertise. So if you're, able to, and the beauty of COVID is it taught us that virtual education is actually very feasible and
Right.
useful. So, anyone, if you're able to volunteer to do some virtual training and workshops, so we'll update that form and have that available as well.
Okay. So now we focused a lot because the work is so important, and I wanted to, amplify the voice of Susu and give you the platform for that. Ordinarily, I delve into the mind of the boss lady. And so I do want to do that just a little bit
Okay.
because, you saw a need and you did something about it. It might have taken a while, but you conceived of it and you did something about it. And I'm just wondering what gave you the agency to know that that was something that you could do, because this is a big thing. You're doing a foundation, raising money and helping people across the ocean. It's not the same as if you're helping people in your immediate community,
Yeah.
when you're in proximity. And so who were your mentors? What showed you that this was something that you could do?
Honestly, I complain like the best of them, right? But my thing has always been, if I'm going to complain about something, I have two options. I can complain and walk away. And I do that if it's stuff I just don't care about and it's not worth
Right. Sure.
stressing me out. But if it's something I care about, I'll complain, but then we need to troubleshoot and we need to problem solve. Um, and I kind of, I don't like sitting on the sidelines if there's stuff that
Right.
can be done that we can do and just sit here and watch life go by and just complain. And my siblings are here. My mom said, but I have a lot of family back home. And, when they say home is where the heart is, it's true, because although at this point in my life, I have lived outside of Liberia longer than I lived there, it still is home. And it's hard to see home not in a good place
Right.
and do nothing.
Yeah.
So
Yeah.
even though home is across the ocean, it's still home. So for me, I think it was scary. And I was like, what, are you crazy? You got da da da. But it's easy to come up with all the reasons why
Right.
you shouldn't do it. And that's why my tagline again goes down to the if not you, then who, if not now, then when. Because I felt like it's like an itch. Like I kept putting it off because
Yeah.
it wouldn't go away.
Kind
So
of like kind of like medicine, right?
yeah, exactly. So it was like either do something about it or just it's gonna bug you.
Yeah.
So
So now, how does it feel to be somewhat on the other side of it? I think I often wonder about, well, I mean, I know this for myself too, just from, developing the retreats and Boss Lady Dream Builders and all that. But how does it feel to you to put something, you showed us your notebook where you first made notes, to have something that you had on that first was conceived in your mind, then you wrote down on paper, and now it's a living, breathing thing. How does that feel?
it's exciting and scary at the same time. It's really exciting. I'm excited about what we've done and how much more we can do, because I do see this growing and evolving. And that's why I love the focus on collaboration, because I never wanted it to be something where I haven't lived there since I was 15.
Right.
I'm not the person to barge in and tell people who are doing the work and working their butts off on the ground how to do their work and how to take care of their patients, but I want to help.
Yes.
So I'm excited that I have been truly blessed to connect with really incredible people back home who are doing amazing things, and I can just help and build on that. But it's also scary because we're getting bigger.
Yeah.
I got a full-time job. I
Yeah,
got
yeah,
I had
you're
these
up to the task.
kids.
You can do it. I've known you a long time.
I had a job and I got these kids. But it's necessary, and it's needed, and it's necessary, and we have lots of good people that we can support. So I'm really truly excited about what's to come, um, because I talked to some people, some of my Liberian friends who have kind of given up, and if like,
Mhm.
we're just not seeing nothing's improving, blah blah blah. But I'm
Yeah.
like, again, it's like we can sit here and complain and nothing's improving, or we can try to help. So I'm excited and scared at the same
Okay.
time.
So now you mentioned way, way back
Mhm.
that you were burned out before you went for your MPH. So
Mhm.
what do you do now to care for yourself so that you don't end up burned out? Because you mentioned that you're a mom,
Mhm.
and we heard that you are in charge of the medical students, and you're on the diversity and inclusion board, and you're practicing urologist, and you run this foundation that is growing by the day. So
Yeah.
what do you do to maintain your self-care and your mental health and your wellness so that you can avoid burnout?
So interestingly, the very things that look like they're piling on are the things that bring me joy,
Mm,
right? So mentorship, because remember, if I hadn't met Miss Dr. Lady when I was a college student, I would not be in medicine. And oh my gosh, I wish I could remember that woman's name and let her know how she changed my life. But anyway, so for me, mentorship, and that's why like I love doing the med student clerkship, because I get to interact with remember we were bright-eyed, bushy-tailed, like med students. Right? Oh my gosh, this is so
right,
cool. So I love that. And it's an easy enough lift, that it really does not pile on, too much. The DNI Council, again, I am passionate about health equity, health disparities, diversity, equity, inclusion. So those are things that actually fill my cup. So they might look like
sure.
they're piling on, but they fill my cup. And when I need to decompress, I travel.
Yeah,
I
yeah.
travel. I did my solo trip for my birthday. First time I had traveled by myself, and Ryan, if you're watching, I do plan on doing more. Um, because I took a Sunday to Friday trip by myself and was just able to relax, regroup, decompress, and it was amazing. So
Yeah.
travel helps me, music helps me. Like when I'm at home, he got me a record player for Christmas, so I have some vinyl records, and I'll hang out on the couch and just veg out to some Whitney Houston, a Prince, a Al Green, and just kind of,
Yeah.
decompress. But so yeah, so for me, interestingly enough, the things that look like they're piling on actually are the things that fill my cup. But I did, after a few months with my current group, because I moved here in 2022, initially was hired to do a 5-day work week. And I realized very early on that I'm not cut out for that. Like, the practice is really busy. And with five days, y'all, when your doctor's working 5 days, they're probably working 60, 70, 80 hours, because it's a
Right.
lot.
Easily.
Yeah. So very early on, I scaled back to 4 days. So I've made adjustments, and that's what I love about my group, because I had the flexibility to do that, to scale back to a 4-day work week, to shift the start of my clinic, from 8 to 9.
Right.
I can drive my kids to school. Just having a time with my girls in the morning starts my day off right. So those
Right.
little adjustments have really helped.
And so, I want to point out a couple of things in that. The first is that you owned your power to make adjustments, because sometimes we just accept things as they are without question,
Mhm.
so we work the 5 days and we don't say anything because we don't want to ruffle feathers, or we don't want to seem like we're a complainer. But, it's your life, and it's your quality of life. And you have every right to speak up for yourself and to ask for the things that you need. So that's
Exactly.
the first thing that I wanted to highlight. And then the other was that the alignment. You talked about it seeming maybe weird that the things that seem like they were piling on were actually things that energize you. But it doesn't seem weird at all, because I think that we get really tired and burned out when the things that we're doing, the way that we're spending our time, is actually out of alignment with our true priorities and values.
Mm.
And so when we're doing things that are in alignment with our priorities and our values, it actually energizes us
That's
rather than draining us. So those are the two things I wanted to point out.
You're so smart.
I get it from you. Anyway, so we're about out of time, but thank you so much, friend, for coming on and talking with
Thank you
me
for
and
having me.
sharing about Susu. So guys, I put the link for Susu Health Foundation in the comments. You know, we're not judging the site. We're just going there to get information and donate. Definitely follow on all social media platforms, because they are doing great, great, great work. There is no donation that is too small. And, you know, please let us know how we can support you. So, you know, in the Boss Lady Dream Builders Facebook group or anywhere, just let us know how we can be of support to you.
Thank
Because, you know, you also talked about collaboration, and we don't do anything by ourselves. And
Exactly.
that's one of the things, that one of the lies that we've been kind of sold in this country in particular, is that, you know, everybody's got to pull themselves up by the bootstraps and all of this. No, that's not true. We
Yeah,
were created to be in relationship with each other and to help each other.
exactly.
So, you know, what we can do, we will do.
Thank you so much, friend.
So that's it for tonight, guys. We will see you again next week. You know, if you have questions for Dr. Gjanje, I didn't really open it up for questions, but if you have questions, definitely put them in the comments. I'm happy to pass them along. Follow Susu Health Foundation on all platforms, and I'll see you next week. Take care. Bye-bye.
Thank you so much.
Thank you.